I've been in contact with an eminent epidemiologist, Joseph Mangano. He works with the Radiation and Public Health Project. His work is reviewed by several MDs, several PhD statisticians, biostatisticians. The following is a statement by Joseph J. Mangano. Joseph Mangano, Master's of Public Health, Master's of Business Administration, is Director, Secretary, and Executive Director of the Radiation and Public Health Project. Mr. Mangano is a public health administrator and researcher and has studied the connection between low-dose radiation exposure and subsequent risk of disease such as cancer and damage to newborns. He has published numerous articles and letters in medical and journals in addition to books including low-level radiation and immune system disorders, and a topic, Era Legacy. Here he examines the connection between radiation exposure and current widespread health problems. He cites the rising local cancer rate suggests link between the Fermi 2 reactor and cancers. January 14th, 2009, the cancer death rate in Monroe County has been rising since the late 1980s when the Fermi 2 nuclear reactor began operating, according to this new analysis. The rise in cancer has been sharpest among children and adolescents who are most susceptible to the harmful effects of radiation exposure. The analysis uses official data from the U.S. Centers for Disease Control and Prevention. The increasing cancer rate death among Monroe County residents, especially young people, suggests a link with radioactive chemicals emitted from the Fermi reactor, says Joseph J. McGowan, MPH, MBA, Executive Director of the Radiation Public Health Project. Because Monroe County has a low-risk population that is well-educated, high-income, and has few language barriers, rising cancers are unexpected and all potential causes should be investigated by health officials. Fermi 2 reactor began operating June 21st, 1985 and went commercial January 1988. However, it ran very little after the initial low-power startup. The 1998 startup was the full commercial operation. In the early 1980s, the Monroe County cancer death rate was 36th highest of 83 Michigan counties. By early 2000, it had moved up to 13 highest. From 1979 to 1988, pre-Fermi, the cancer death rate for Monroe County residents under 25 years of age was 21% below the U.S. rate. But from 1989 to 2005, when Fermi 2 was fully operational, the local rate was 45.5% above the U.S. national average.